Thanks for joining us today. My name's Sarah Montel. I'm the bariatric coordinator here at Community Health Network. And with me I have Marjorie Klein.
Yes, and I'm the licensed clinical social worker here at North, do the counseling for the surgical and non-surgical patients that are working on their weight loss journey here with the center.
Yep, so thank you for talking with me today. And as you all know, we have a lot of restrictions here at the hospital. However, our goal is to support all of you on your weight loss journey, and I know there's been a lot of struggles. So today, Marjorie is here to give us some kind of tips and talk through what every one of us is feeling right now. So I'm going to let her just take it away. How about that?
Thanks, Sarah. So we were thinking about one of the things that a friend of mine was saying is that, she's been cooking more and doing more, eating more, and another friend of mine said, all I've done all day is eat. So I just thought I'd just do something on coping with the anxiety and stress of what we're dealing with right now, especially in our home. So I just laid out I have about 11 things, and I have a little story at the end I thought I'd share. I had a patient give me permission to share her little story. So, of course, one of the things that we all need to do is we all need to be informed about what's going on. That is something we absolutely need to do. But, and the worst thing you want to do is be in denial about what's going on with current events. But I just really think be careful not to immerse yourself in the media world. Be sure you take a break. We need to remind ourselves that there is more to who you are and than what is going on in the world right now. So I thought that might be something to make a point to say. And I do think that using the distractions do work. And however you want to do that, and I just will share this. I recently discovered on an app on my phone that is like color by numbers, and that took me back to when I was a child and I used to do those paint by numbers things. So I'm just really enjoying that part. So I just think doing things that you find helpful to distract, it is good to do.
I think that's such a good tip because I find myself scrolling through my phone reading article after article after article, and pretty soon you're just consumed with things. So I think that's a great idea.
Yeah, I just take a few minutes to distract. So I had whatever that is, and I just shared that because I've been really enjoying this. It's this color by number thing. And then from therapy, we know whenever anybody's anxious, we do recommend relaxation breathing, and it's very simple. You just breathe in through your nose for the count of 4. You hold it for a count of 7, and then slowly breathe out to a count of 8, like you're blowing through a straw. When you do that, and usually you do that in a cycle of 4, your heart slows down. You can't help but feel relaxed because your heart slows down. There are things written on the internet about relaxation breathing that you can look at, guided imagery and things, but we know relaxation breathing helps with anxiety. So that's something else that you may want to try. You can do that anywhere. No one really knows you're doing it. I mean, I tell people you do it at work in a meeting. If you feel a little anxious and nobody really knows you're doing it, it's very subtle. And treat yourself to maybe doing something to treat other things other than the taste sense, like the sense of smell and a bath. Treat yourself to a bath, candles, just other things maybe to treat the other senses other than maybe the sense of smell or taste. And then of course there's balance. A long time ago, I went to a workshop. I was a fairly seasoned therapist, and I said, I'm not going to get anything out of this workshop, but I had to go because I have to get my CEUs. And I said, okay. I came out of it with something that I didn't expect, and that was the idea that how mental health professionals, we tend to go to medication things before looking at just the normal balance of good nutrition, food, exercise. And so that's another reason why I'm real excited about being at this clinic, because that's what we're teaching is self-care, balance, good nutrition, good health, good exercise. So I do think you need to look at balance. Don't hibernate in your bed. If you can, it is good to get outside a little bit and get outside your head as well. And I think indulging in food, alcohol, it just makes people feel worse. I think it's a short term, but we feel worse. So if you can find other things to do, that's something that I think makes sense. It's the whole idea of balance and self-care. Big on that.
Right. Can I say something?
Please do. Please do.
And I think one thing we hear as dietitian is oh gosh, I can't find this at the store, there's a shortage of this in the store, what can I do? Sometimes you have to make the best decision on what's there. So you know what,
Yes.
they might not have grilled white meat chicken breast, and you might have to have maybe a meat with a little bit more fat in it, but you know what, still better than Doritos, right? So sometimes, given where we are, we have to make the best decision, and so don't, if things are not available, just make the best choice that you can do, and we've got lots of dietitians to help you.
I'm
with
glad
that.
you said that, because that's basically what I've been telling other patients, because they're finding, and it is real, that things are not as plentiful in the groceries, and we can't get the things that we might normally want. So yeah,
Yeah.
that's a good point. The other thing Sarah and I are gonna do a little emotional eating video next, so I'll have that, a little bit more talk about the emotional eating piece too. So the other thing we talk a lot about with folks is just remember to focus on things that you can control. There is so much going on right now that we are out of control. I mean, you are in limbo a lot of times in working with your weight loss journey. We've got additional limbo going on, and limbo is a very difficult place to be in. So I think just try to focus and look at what you do have control of. And I have a patient that I learned from her this little technique. She and I were working. She's pretty anxious. This is several years ago, and trying to help her look at what she can't control. And she came into my office. She was all excited, and she says, "I figured it out." And she said, "I visualize a road, and I think, okay, what is it that's on this side of the road that I have control of and I can take care of? What is on that side of the road that they're going to have to take care of, whoever they are?" So I think I just passed that on, because I've used that several times on what is it's on your side of the road, your side of the street, that you can take care of. So, and there's a lot that we do not have control of, but so that's one of the things I thought might be good. And it's just talk to other people, take emotional risks, talk to people how you feel, ask people how they're feeling, and all in an attempt to just resist eating your feelings. I had a patient that I talked to earlier this week on the phone, doing all phone work right now, and part of my typical practice is at the end is just to ask, well, what was important about talking with me? And she said, just talking to someone about me. I thought that was so wonderful. She said, just being, because we're really dealing with a lot of care for other people. She said, just talking to someone about me. So yeah, I thought
That's a good one,
that was really good to hear that she found that helpful. And I think we need to watch on dwelling on our negative feelings. It's easy to look at the negatives and just avoid the positives, but I think just, if we can, taking stock of what some of the positive things that we do have around us. I sent a little video out today, but I saw this thing on Facebook. It made me feel good, so I'm gonna send it out. It's positive.
Right, and there are, as negative as things can be, you always see the positive. There's lots of positive things that people are doing at this time and helping each other and reaching out, which is so fun to see.
Being a part of this team has been a very positive
Absolutely.
experience during all this time, and trying to do what we need to do for the patient. So there's positives here. And then of course the rational self-talk. It's easy to climb with that negatives, to get into your just irrational thoughts, catastrophizing things, overgeneralizing things. And I think when people are anxious, there is a desire to just make it go away. And I don't know right now that the anxiety we feel is going to go away. It's very real. I think our attempt is, let's figure out how we can manage it in a way to not send us into a place where we don't want to be. So this is all about managing. Nobody's going to tell you that this stuff isn't real, because it is. Let's see, and I think connecting with your spiritual side, however you define that to be, whether it's the traditional spiritual higher power or the creative side, but I think that can be helpful. Creativity, crafts, family, laughter, just things that can kind of feed that creative spiritual soul, I think is something. I'm not a huge tech savvy person or Facebook person. I have been doing more of that because there's a lot of really nice little quotes and things coming on the internet that I've been enjoying. So I think that's been something that we can do. If you can, keeping up with as much of your daily routine as possible is probably helpful. Shower, get dressed, but don't be afraid to try some new things. I think that's something that's good, to get outside that comfort zone. And I had this epiphany
not just here, but just watching my mom. A lot of you that know me know that my dad recently passed, and my mom, one of the things that I know that she's really doing as good as she can, because I go over to her house when I could, and then she's getting dressed in the morning, she's taking her shower, and she's making her bed. And those are just some of the normal things that she can do instead of hibernating and things like that. So I think if you can, do that. And I have to add this. It's like, just appreciate, spend time with your fur family. It does show petting your animals does make people feel good, and they're so happy that we're a lot of us are home. So I added that because a lot of you know that I'm very much an advocate of the animal kingdom. Anything else there before I tell my little story that you want to share?
No, I think these are all really helpful. I mean, I'm just sitting here just soaking it in, taking notes, and it applies to me for sure.
So I had a client Monday. It was the first person that I talked to this week, and I asked her if I could share this story with you, and she said that I could. Of course, I'm not going to share her name, but I was asking her how she's always do check-ins, and I asked her how she was doing, and she was talking about how she was really feeling pretty good. And I go, oh, good, tell me. This is my first patient of the week. Tell me what's good. She kind of shared the story how she had been home with her children. They're home. She's playing teacher. Her husband's at home working. She's doing a lot of things outside of what she would normally do, and she's like, and she's in my group, my emotional eating group, and we're talking a lot about self-care. And she said, I'm not able to do the things I was doing for self-care, and I'm wanting to eat. And she says, I'm not giving in, but I really want to eat. And she said, I'm just not being able, I'm out of my routine. And so she said, I talked to my husband. She took emotional risk and let her know how she was feeling, which is something I think she would not have just normally, she just kind of does. And then she said, I just started shifting what I was thinking and looking at, okay, what do I have control of in this situation? And she said, okay, I sew. And so she said, I can maybe make some of those masks for people. And then she reached out to other people, and she started working with them so that they can make masks. And before you know it, she's now organizing this little group of people that are making masks. And she said, I'm just feeling empowered. I'm feeling good about myself. I'm still losing weight, and so I just really felt very, I don't know, just happy for her that she was able to take some of the things that she'd been learning here at the center and apply, and it seemed to be working for her. And so I don't know, I just thought I'd share that as a little inspiring story, because it certainly inspired me. Maybe it'll inspire some of you all too. So
Definitely.
So that's what I had, just little tips.
That's super helpful for me. I bet it's helpful for all of you. I'm posting this video on our Facebook page. This isn't a live, this is a pre-recorded video. So if you have questions, if you have thoughts, comment, and I'll let Marjorie know, and I'm happy to answer those for her when I get her information. So thank you guys. We're going to do lots more of these to keep all of you guys connected, and also to help us connect with you, because we miss seeing everyone. So this is a lot for us as well, to connect with you. So thank you guys.
Have a great weekend.
Bye.